I wanted to invite members of our development committee up to the table. That would be Beth Johnston, Amy Beckier, Ellen Hannon, and Ellen Stenman. Ellen, if you're around, Ellen Stenman. Okay. And what do I use this to advance this? Okay. Yeah. So, hi, I'm June Kinoshita, Executive Director of the FSH Society, and I wanted to spend a little time today at lunch just giving a quick overview of what we do. None of this going on today. I mean, this is an amazing gathering, and of researchers and all of you patients and families. You are the FSH Society, and none of this would be possible without your support and the support of our sponsors. So thank you all so much. And I feel we're a patient-driven organization. We really are accountable to you. We try to listen to you. We try to hear what you need. We're trying to serve you, and all in the pursuit of our vision and our mission. So our vision is really to deliver treatments and a cure for FSHD. And we want to do that by being a catalyst for connecting all of the stakeholders. And this meeting itself is a living demonstration of that. The researchers, the clinicians, some companies are here, investors, as well as you patients and families. And we're only going to get to a treatment and cure by connecting you all, making these conversations happen, exchanging knowledge, and increasing our knowledge about FSHD. And I guess that speaks to my second point. We are promoting research focused on FSHD through thought leadership, networking, and funding. And it is important, as you know, that genetics is unique, so the treatments are going to be unique to FSHD. There are many other muscular dystrophies and other applicable technologies and so on that we will be able to use for FSHD, but to really address and solve the problem of FSHD, you really need a very singular focus on FSHD, and that is why the FSH Society exists. And we have a number of strategic imperatives. How are we going to accomplish these aims? Number one, we need to empower patients and communities. We need to give you the tools to take action. As Senator Warren said this morning in her address, you need to speak up. You need to let people who have access to funding, who can release funding, who can give priority to FSHD, you all need to make your voices heard. And we can help with the tools how to do that. When do we need to write to Washington? What's happening legislatively? What's happening in your healthcare communities, et cetera? And we also do it by connecting you and communicating, of course, through our newsletter, our website, and through all the ways in which we reach out to you to try to educate you about what's going on with FSHD research. Finance, very important. None of this can happen without funding. And we need to, right now, we're on the brink of going into the era of drug discovery and development. And we're just going to have to ramp up the financial resources that can be applied to this. So that's a great challenge to have. I mean, it's, and we need to grow and diversify that revenue to invest in all of the factors that come together, the research itself, the education, supporting patients, and as an organization, our own operational capacity. So that's a really important thing. And then knowledge. How do we drive the development of research directed towards treatments and a cure? And we've achieved a lot in the 23 years since the society was founded. We funded over $5 million in research grants, much of it seed funding that has led to transformational discoveries in this field. And we've created a global research program, scientists from around the world working on FSHD. They were really, Dan Perez is an amazing individual. He literally was knocking on doors, probably he's got scars on his knuckles, I'm sure, from all the knocking he did to persuade top-notch scientists to take an interest in FSHD and to provide the money, scrape together the funding to get them going, and lobbying Washington, helping to enact, the passage of the MD CARE Act so that there's much larger funding available for research. And every year we convene an international meeting of scientists so that they can really communicate and exchange information and really work together as a global research community towards working on FSHD. And also patients. We have a worldwide network. I mean, we have people from Australia, Brazil, France, England, Canada, and Kenya in the room. I mean, people have come from all over the world because where else will you meet so many FSHD patients, have so much access to information, and you all have so much knowledge and you share it, and that's how this community is going to strengthen and grow. So we are the sort of conduit to help bring you together for that to build that community. So just to give you an idea, just in terms of funding, U.S. government funding for FSHD research really began with the MD CARE Act in 2001. And that was, then there was an action plan in 2006, and the MD CARE Act is in the process of being reauthorized. We, knock on wood, it will be reauthorized. And what a difference that has made. From $400,000 spent in 2001 on FSHD-related research to over $5 million a year now. And the $5 million that FSH Society has granted over those 20 years has been leveraged into $78 million plus of NIH funding. So those NIH grants would not have been given to scientists without that data that they acquired through the seed funding that the FSH Society and other advocacy organizations funded. And, the sad fact is FSHD remains underfunded. We looked at 2013 NIH funding for diseases with similar or even less prevalence than FSHD. And, the paper that Dan referred to earlier, the prevalence of this disease is higher than what is currently cited in official, a lot of publications. So it's even more prevalent than we thought. But compared to, it's not all of these diseases need and deserve funding. But you can see, relatively, we have $5 million a year from NIH for FSHD, and these other diseases are getting significantly more. So, that's not a great thing, except what it does say is we have made remarkable progress on relatively few resources compared to these other diseases. So that just demonstrates how effective we have been as a community. And there are now great challenges because as we get into the era of drug discovery and development, a lot more resources will have to be applied. The cost to develop a new drug is $100 million plus these days for a single drug. And I hope there are ways to be smarter about it and bring down that cost, but it's really, orders of magnitude beyond what we have been able to draw together. But there's really good news there because we are starting to hear from biotechs and pharmas who have serious interest in working on FSHD thanks to the progress that's been made, the fact that we now have therapeutic targets, the fact that patients are in a network that we can access lots of patients, we can get the information out to all of you to participate in clinical studies and clinical trials. That's really important for companies. When they see that that kind of network exists, that greatly reduces their risk of going into that field. They know that they'll be able to reach patients for clinical trials. We also are playing a really important role right now in coordinating the stakeholders. There are certain things that need to happen for clinical trials to go forward that really require a strong, well-organized patient advocacy organization. It's not something that companies can do. It's not something academic institutions can do. It's really the province of an advocacy organization. It's pulling the stakeholders together to develop an FDA guidance document, like what the Parent Project for Duchenne has just done, and that's been covered extensively in the media because it was an extraordinary kind of first for a patient advocacy organization to say, we can't wait around anymore for someone to figure out what the FDA needs to, accept for a clinical trial, we have to do it, and that's something I think the FSHD community is going to have to look at in the next few years. And then I do also want to say, even though we're at this brink of starting to go into drug discovery and development, we still really need to support basic research. And there's a real danger that, you get beguiled by, drug discovery, that's all really sexy and can get into clinical trials. But what happens if the clinical trial fails, doesn't work for a certain group of patients, and you haven't been replenishing the pipeline of ideas, of new targets, of different ways? I think disease like this, you're going to need cocktails, you're going to need multiple ways to attack this disease. And you're going to have to tailor that to different individuals because it's a very heterogeneous disease. And to do that, we need to keep investing in that basic research pipeline. So your support is more important than ever, and that comes in many forms. Financial support, donations, obviously very, very important to us. We wouldn't be standing here, we wouldn't be doing that without those donations. We have a legacy circle. This is planned giving, so in your wills, bequests, and so forth, please think about the FSH Society when you do your estate planning, because that helps to provide for our long-term health and sustainability of this organization. Organize and participate in fundraisers. We're going to hear in a moment from our panel about really creative ways to do that, and that is a growing, very important part of what we do, because we're small in numbers, and we need ways to engage larger circles of your community to care about and get involved and contribute to it. And fundraisers are a wonderful way to do that. It's also a way to raise awareness. And tomorrow at lunch, we'll be talking about some awareness-raising initiatives. And you can support us just by telling your friends and family. You don't necessarily want to, wear the fact that you have this disease on your sleeve, but until you tell people, they will not know. They don't know that you have this. They've never heard of it. When you tell them, it's suddenly something that they're aware of, they start to care about. That's incredibly important. It's a very simple thing. It doesn't cost a dime. And volunteer. You all have so many skills. They're so valuable, so important to us, and we appreciate every volunteer who comes to us and wants to help. So what we can do together is incredible. I'm convinced that we will have treatments to slow or stop FSHD if we can continue this course and continue the growth that we're experiencing now. And we'll be able to improve health care and the quality of life through better understanding of FSHD. And we'll be able to ensure that the pipeline for new drugs is replenished. And we will be able to continue in our role as an advocacy organization to secure more funding from governments, from other nonprofits, and from industry. And so some things you can do right here at FSHD Connect this year. We have event flyers out on the table right outside the door. We have, I think, 8 or 9 events coming up this fall. One of them may be in your area, or you may have friends and family in that area. So pick up a flyer and come to these events, support our events, even if you can't attend. Show support to these really hardworking volunteers who chair these events by making a gift in honor of that event. Or if you have friends in that area, as I say, mail the flyer to them or email them. This afternoon at 2 o'clock in Harbor Ballroom 1, we will have a breakout session on creative fundraising. So if you have ideas about ways to do fundraising, come and we can brainstorm about it, and we provide a lot of mentoring and support for fundraisers. And so thank you so much.